Bisacodyl is a medication that is used to help with constipation. It can also be used to clean out the intestines before a bowel examination or surgery. Bisacodyl is classified as a stimulant laxative, which means it works by increasing the movement of the intestines, making it easier for stool to pass. It is important to follow the recommended dosage instructions provided by your healthcare provider. Women's laxative can be taken with a full glass of water, and it is best to take it at bedtime or as directed by your doctor. Be sure to drink plenty of fluids while taking this medication to prevent dehydration. This medication is intended for short-term use, so it is important to talk to your healthcare provider if you have ongoing constipation issues. When taking women's laxative, it's important to follow the directions given by your doctor or on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. Remember to swallow the medication whole and avoid crushing, chewing, or breaking the tablet. Also, make sure not to take the medication within 1 hour of consuming antacids, milk, or milk products, as this can affect the effectiveness of the medication and may lead to stomach upset and nausea. The dosage of women's laxative is determined based on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take the medication more frequently than directed. Do not use this medication for more than 7 days unless instructed by your doctor, as overuse can lead to serious side effects. It typically takes 6 to 12 hours for women's laxative to produce a bowel movement. If your condition persists or worsens, or if you experience bleeding from the rectum, be sure to inform your doctor. If you suspect a serious medical problem, seek medical attention immediately. If you experience stomach/abdominal pain or cramping, nausea, diarrhea, or weakness, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects. If you do experience any serious side effects such as nausea/vomiting/diarrhea that doesn't stop, muscle cramps/weakness, irregular heartbeat, dizziness, fainting, decreased urination, or mental/mood changes, it's important to inform your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and you should contact your doctor or pharmacist if you notice any other effects not listed. As for the optimal timing and dosage, it's essential to follow your doctor's instructions. The best time to take this medication and the recommended daily dosage will be determined by your doctor based on your individual needs. Always consult with a healthcare professional before starting or stopping any medication. Before taking women's laxative, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, make sure to discuss your medical history, especially if you have symptoms of appendicitis, a sudden change in bowel habits, bleeding from the rectum, or intestinal blockage. If you are planning to have surgery, it's important to inform your doctor about all the medications and products you are using. For pregnant women, it's not recommended to use this medication for long periods, so make sure to consult your doctor for more details. Additionally, it's unknown if this medication passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. When it comes to the daily dosage and optimal timing for taking women's laxative, make sure to follow the instructions provided by your doctor or pharmacist. It's important to be aware that women's laxatives may interact with other medications, which can affect how well your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with women's laxatives are medications that decrease stomach acid, such as H2 blockers like ranitidine and proton pump inhibitors like omeprazole. Always consult with your healthcare professional before taking women's laxatives if you are using any other medications. And remember to follow the recommended daily dosage and take it at the optimal timing for the best results. If someone has taken too much women's laxative and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center for assistance. Symptoms of overdose may include nausea, vomiting, diarrhea that doesn't stop, severe stomach or abdominal pain. It's important to keep all medical appointments and follow up with any recommended lab appointments. In addition to taking women's laxatives, there are some lifestyle changes that can help prevent or relieve constipation. This includes incorporating regular exercise into your routine, staying hydrated by drinking enough water, and maintaining a proper diet with fiber-rich foods such as bran, fresh fruits, and vegetables. If you have any questions about how to make lifestyle changes that could benefit you, be sure to talk to your doctor or pharmacist. When it comes to taking women's laxatives, it's important to follow the recommended dosage and timing. Be sure to talk to your doctor or pharmacist about the best time of day to take this medication, as well as the daily dosage that is appropriate for you. If your doctor has instructed you to take women's laxative on a regular basis and you happen to miss a dose, take it as soon as you remember. However, if it's close to the time of your next dose, it's better to skip the missed dose and just take your next dose at the regular time. Avoid taking a double dose to make up for the missed one. It's important to stick to the recommended dosage for best results. As always, consult your healthcare provider for personalized advice. When it comes to storing women's laxatives, it's important to check the product package for specific instructions. It's essential to keep all medications out of reach of children and pets. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.